Hi, and welcome into today's HealthWise. I'm Ralph Hipp. Today's show helps our patients with the severely debilitating problems of sleep apnea and the different varieties of that. And to talk about sleep disorders, we welcome Mike Conlin of Jayhawk Pharmacy and Patient Supply back again with us. Mike, it's great to see you again.
My pleasure. Thank you.
All right, good to have you here, and some of your friends you brought
Absolutely.
over. Well, we're here to talk over the serious business of, first of all, OSA, which is obstructive sleep apnea, and sleep disordered breathing. Are they two different types of categories of apnea?
There's actually, the obstructive disease is more where your airway is not open. So what we would do with a therapy, with an examination on the part of your physician and then treatment, is open that airway with pressures. And then within other categories of sleep apnea are ones that are more brain driven or central sleep apneas, is how they're described. And that's a different technology. That's a far more sophisticated technology than what you or I may think of a typical sleep apnea patient.
What's the definition of sleep apnea? These are the things we're going to go over today with you, but how do we define sleep apnea?
Sleep apnea is just that inability to exchange air back and forth. Many of us, perhaps our bed partner, someone within our lives will complain, mention, remind us that we snore, that we perhaps snort, we quit breathing.
They're our best person to notify us
well,
of that.
Absolutely.
Yeah.
They're there and involved, and it can be very disruptive to a family. And oftentimes that's where the first complaint comes, is that you need to have that taken care of or looked at least.
The SDB, the sleep disordered breathing, and what are the consequences if we let that go, if we don't treat that?
There are so many consequences. If you just think of any of us when we don't get a good night's sleep, you wake up tired. The other consequences can be automobile accidents. It can exaggerate or exacerbate our high blood pressure, heart failure, diabetes, a multitude of things that are all consequences of being untreated with obstructive sleep apnea.
And the impact of the untreated OSA, is that the same? Or if we don't treat our obstructive sleep apnea, what happens with that? Do we see some different health problems that might arise from that situation?
Well, for an example, a third of the individuals with sleep apnea are hypertensive. So you obviously want to treat the obstructive sleep apnea. About 50% of the folks that are treated for obstructive sleep apnea have some sort of heart malady in terms of myocardial infarction. And then thirdly, obesity is unfortunately a big player in the treatment of obstructive sleep apnea.
Mike, and I don't know if I shared this with you, I was diagnosed in the last few months, early this year, with severe sleep apnea. I am a patient, and I have one of these. I have, I believe this guy on the right. I have a mask like this, and describe the help that patients like me and all of us out there can get to treat our sleep apnea.
One of the things we really want to keep in mind is the devices are essentially the same in terms of how the amount of air that they provide. The doctor during a study can evaluate your inhalation, exhalation, your in and out breathing, and then what really drives the success of sleep apnea treatment is what we call the interface, or some people would just simply say the mask. The least obtrusive is the device that is just called a nasal pillow. It's very gentle. Most times folks are a little frightened of obstructive sleep apnea or OSA simply because they're claustrophobic, so that's a good choice for that individual.
I'm sort of getting over that.
Yeah.
It's a big mask on there, but if you're a mouth breather, you have to have the big one.
Well,
so some people, would you know a percentage, Mike? How many of us do breathe through our noses where we could have a smaller one, and how many of us are mouth breathers?
I'd say the preponderance of the people that we care for are able to get away or to be treated with something that simply is applied over the nose.
Right.
When folks are mouth breathers, then it necessitates the bigger sort of mask, and that's really the art of fitting a patient and treating a patient with OSA.
In Topeka, how would we get tested for sleep apnea? There are the sleep laboratories in some of the major hospitals.
There's actually three ways to approach it. There's a device called an Apnea Link that we have to offer. It measures, it's basically the size of a little pager. Put a nasal cannula on, and during the course of the evening that measures your breathing episodes, and then that can be downloaded and forwarded to your doctor. That does not qualify you for the treatment for the machines and the devices that go with it. Secondly, there's new technology that's a home sleep device. So you have a fellow that perhaps lives out somewhere, or really doesn't want to sleep in a sleep center. Perhaps a farmer 2 hours away from the sleep center.
Could be done remotely?
Can be done simply by applying the device at home, getting it back to the facility, the sleep center, downloaded, and then it qualifies an individual for care. And then the third is that when you do a sleep study at a sleep center.
To help treat all these things. Mike, it's amazing how many health problems develop from sleep apnea. It's just the hypertension, the defibrillation, the heart failure. And what are some of the other ones that we should be warned about if we have sleep apnea?
It can affect your blood sugars, so
Wow.
diabetics need to be aware. Keep in mind that over 80% of the individuals that we treat for obstructive sleep apnea are unfortunately obese. So those two just really add to each other's
Right.
aggravation.
If they have been diagnosed, they say, I'd like to talk with Mike Conlin a little bit more about this and get one of these fellows on my nose or mouth. How can they reach you? And what's your website and phone number?
We're at jayhawkpharmacy.com, and our facility is at 2620 Southwest 6th and 785-235-9700.
And give us that number one more time.
It's 785-235-9700.
Okay. How about you? Have you been an apnea patient, or you're one of the fortunate ones?
No, I'm actually one of the fortunate or unfortunate. I do get a good night's sleep now, as does my wife, and it's simply, I resisted as everybody does, but found that a good night's sleep is certainly worth going through the process of evaluation.
It's, for me personally, as I can share a personal note, it's certainly been worth it for me. It was a lot of work to get diagnosed and wear all those wires, and to have the mask on and be able to sleep at night for hours and hours at a time. It's a great thing, and you will enjoy it too if you're not doing that. Mike, thank you, and we'll see you later.
My pleasure, thank you.
Something else that'll help you, we're going to get ready for some low impact exercise here on HealthWise, and be sure to check with your doctor before you begin any exercise program.